like right now, asking these questions, is that what patients are comfortable with, trusting? Do they even know? Should they know? Should we be asking permission? It occurs to me as you say that, it's like, wait a minute, that's a different level of trust if we're gonna have a recorded conversation, and then I start to worry about, well, who has access to that?
Totally. These are a lot of the questions that we've been asking ourselves. One of my roles is I work with the Open Notes Lab, which is a team that does a lot of patient transparency research, and we've been actually having some conversations with a healthcare architecture firm looking at these elements of what happens when there's recording in the room, or even what is that room setup like. And I think there's a couple of elements to this. One, there's a cultural shift, right? If we move to a healthcare system over time where the expectation is that there's an AI recording system, that may start to feel more the norm, but right now that's not the norm, so we're going through the shift. But then there's also a lot of questions about agency and consent, right? Who gets to decide if they don't want to have the recording device? And from a patient experience, sometimes a similar analogy in the current world is, I've gone through medical training, and as a medical student and resident, sometimes we are invited to join an attending physician in the room, and as a patient, you see a bunch of trainee doctors in the room, and you may not feel comfortable. Sometimes you may ask someone to leave, but a lot of patients don't necessarily have that agency or empowerment. Just providing that as an analogy that I've heard some patients make, but when it comes to AI systems, there's still a lot of open questions of that control. And even for the clinicians may have concerns about themselves being recorded because there's a question of, will this be used to evaluate my job performance? And they may be hesitant, but I think ultimately it comes down to what is the utility here, and I think if this technology allows for a stronger human connection, if patients feel like their doctor is actually listening to them more, and more details were recorded and kept, like with the example that Lucas was giving about a patient coming in with GI symptoms and a doctor maybe now not having to type that in, maybe they have a little bit more time to get into their dietary history, which sometimes can be challenging to fit into a short visit, and that may offer some significant clues. So that technology, if it offers more time, more connection, and then finally the promise of the ambient AI technology is to be able to generate clinical summaries, not just the clinical documentation for the physician, but also patient-friendly summaries. And so I think ultimately it's about the utility of this technology, and that's an important part of the conversation with trust.
So